leur garantir leur droit.
Voilà.
Reprendre l'escalier.
Tout le monde voit, monsieur.
L'élément le plus important, c'est le contrôle de santé au départ de l'avion. Là-bas, en Guinée, pour ce qui est des vols directs, mais des pays qui sont concernés. Nous renforçons ces contrôles puisqu'ils sont actuellement réalisés par des professionnels locaux et nous allons compléter les équipes sur place avec des professionnels français qui vont donc favoriser les contrôles sur place. Nous rajoutons une étape supplémentaire ici qui doit nous permettre de prendre en charge quelqu'un qui déclencherait une fièvre pendant son voyage.
Bonjour, bon voyage, bienvenue en France. Je suis content. Bon, ça va, merci.
C'est par la multiplication des mesures, par la mise en place d'un réseau extrêmement fin, très serré de contrôle que nous nous donnons les moyens d'identifier, de détecter, de prendre en charge un éventuel malade. Aujourd'hui, en France, il n'y a pas de malade d'Ebola sur notre territoire.
But then it took 5 months before WHO issued a statement and saying that this was a public health emergency. 5 months, 1,000 deaths, and 2 Americans who were repatriated. And that despite the fact that Médecins Sans Frontières were issuing calls and said that this was getting out of control. And the geometry of that must be very sophisticated. I called for a state of emergency and a quasi-military operation because a lot of the response to Ebola has to do with logistics. You've got to build a massive number of hospital beds in no time. You've got to organize transportation, communication and all that. And the military or agencies like the High Commission for Refugees or the World Food Programme, they can do that because they're used to deal with humanitarian emergencies. That's also when I understood that this was not just an epidemic, this was becoming a humanitarian crisis. And then the rest is, it's smallpox and so on. Well, first of all, WHO is organized in a very decentralized way, and it's the regional office for Africa that is the front line, and that is really handling, WHO's activities in Africa in this case, and they didn't do anything, and that office is really not competent, and there are too many people who are there because of political connections. So that's the first problem. And then secondly, I think the organization, through budget cuts, has undermined its own response capacity for epidemics.
Brussels Airport Company has decided to assign a specialized company to check and analyze all the luggages coming from the 3 regions and to decide if they are okay or not. If they are okay, it means that there are no leaking from those luggages. If they are leaking, they will immediately destroy them. No, we haven't any risk for the moment. We don't have Ebola in Belgium, but we felt that the people are quite concerned, and to make sure that operations can go further and to avoid any problem with our colleagues, we decided to implement this measure.